Hello, my name is Leo Gutierrez, and I will be going over the advanced assessment of the Allen's test. Let's get started. So for my introduction, I said that the Allen test is used to assess the collateral blood flow to the hands, generally in preparation for a procedure that has the potential to disrupt the blood flow in either the radial or the ulnar artery. The Allen test can be usually done before radio-arterial blood sampling, such as arterial blood gases, or before arterial cannulation. I want to go over two different scenarios where the Allen test would be necessary. So a client presents with respiratory failure and needs arterial blood gases to determine where their ventilation stands, right? However, you want to make sure that the patient has good blood flow in the radial artery, as they had a history of cardiovascular disease and blockages in the arteries. One of the risks associated with arterial punctures is ischemia distal to the puncture site, which could compromise the limb if there is inadequate blood flow. And then another instance or another clinical scenario would be if a patient presents with shock, severe hypotension, or severe hypertension, and they need constant blood pressure and MAP monitoring for more accurate results. They would need to get an arterial cannulation. But the Allen test must be done to confirm that there's good blood flow to the radial and ulnar arteries. So for my typical cardiovascular assessment, I said we're going to be focusing more on the vascular system itself and not so much on the cardiac system itself. So we first start with inspection of the periphery, which we're going to look at the color at the periphery for color, temperature, and edema. And you would expect the skin to be warm, no edema present, and the color is appropriate to race. Then we palpate the peripheral pulses, whether we palpate the radial, brachial, femoral, popliteal, dorsalis pedis, and posterior tibial. You would expect all pulses to be regular. Strong and equal bilaterally. The pulse amplitude is expected to be at least a +2. If it's anything below that, it's going to be a weak or an absent pulse. If so, then there could be partial or complete occlusion of the artery. And then there's other signs that could also symbolize arterial occlusion, such as pain, pallor, cool temperature, paresthesia, and paralysis. And then the last thing we could also do is a capillary refill test, and this will determine if there is diminished blood flow, depending on the part of the body where we collect it. So with this, we put pressure on any part of the body that needs to be checked for blood flow, and then we expect the color to return in less than 3 seconds. So now I'm going to perform the advanced Allen test assessment, but so I'm going to ask him to make a tight fist, and I'm going to occlude both his radial and ulnar arteries for at least 5 seconds. And then the moment he opens his hands, which is now, you'll see some white. So I'm going to release the ulnar artery and see how the blood flows back into his hand. Well, I'm going to try that again. Okay, make a fist. I'm occluding both the radial on this side and the ulnar artery on this side for 5 seconds. And then he opens his hand and it's still white or pallor. And then I release the radial and it's back to its regular color. Yep. Listo.
Okay.
No. Yep. Anda para allá, todavía no termino. Okay. So let's talk about these results. A positive finding, like we just saw, the hand quickly became warm and it returned to its normal color. This means that the artery that was checked, either radial or ulnar, is enough to supply the blood to the hand and fingers. But let's talk about an abnormal or a negative result. In an abnormal result, the hand will remain pale, and it would also feel cold after releasing either artery. This means that the artery cannot supply enough blood to the hands and fingers. But what is the pathophysiologic process behind this? Well, the pathophysiologic process with these results is an indication of impaired blood flow through an open artery due to atherosclerosis itself, or any plaque buildup on the walls of the arteries. This causes the arteries to become narrow and stiff or blocked, and as a result, it is hard for the blood to flow to the arteries. Other things that could cause atherosclerosis can be due to high cholesterol levels, high triglyceride levels, high blood pressure, smoking, diabetes, and obesity. And like I said, those can all cause atherosclerosis. And I also wanted to touch up on ischemia again and subsequent tissue loss if the radial artery is disrupted and the ulnar artery is insufficient to maintain perfusion of the hand. This is a complication that the Allen test avoids, especially if the Allen test turns out to be negative. You want to avoid puncturing that arterial site. So we talked about findings. Now we're going to move on to further assessment. So for further assessment, I want to ask the patient about their personal health history, and that would include asking if they have a history of hypertension, diabetes, and obesity. And I would also ask them about their lifestyle habits, such as, do they smoke? Are they physically active? Or do they have bad eating habits? Or just what kind of eating habits they have? Meaning, does their diet consist of a lot of saturated fats, which could increase the risk of developing atherosclerosis as well? And I would also want to assess or ask questions about circulation, such as, does the presence of their skin, is it always warm or cool regardless of room temperature? Do they feel any signs or symptoms such as, pain? Does their hand appear to be pale most of the time? Do they feel paresthesia? Do they have any sort of kind of paralysis? And so forth. And those questions will help me determine if they are at an increased risk of impaired blood flow as well, and if the Allen test would be necessary. And now I want to talk about 3 different tests that we could use along with the Allen test, after, or even before. So the first one I want to talk about is digital plethysmography, which, if used along with the Allen test, why is the digital plethysmography very beneficial? Because it records digital pulsation and it measures blood flow by occlusion and perfusion pressure, which is very useful in identifying pulses appropriately. And then we have using the pulse ox while obtaining the Allen test. We're going to look at the 2 wavelengths, wavelength for pulses and oxygen saturation. When you occlude the 2 arteries, the radial and ulnar, those 2 wavelengths are going to disappear. But we're going to know what the baseline was before we occluded the 2 arteries. And the moment that we release one of the arteries and the readings come back, the wavelengths come back, then we'll be able to tell if they're still at the same baseline or not. And then the last thing I wanted to talk about was the blood tests. Either blood cholesterol, or we could get blood cholesterol levels, or triglyceride levels, or even a diabetes test. Blood tests to see if the person is at risk for atherosclerosis, or any chances of them developing plaque buildup in their arterial walls. And that'll be the end of my presentation. Thank you.